My name's Dr. Gunraj Paul. I'm from Birmingham in the West Midlands and I've never worked in the North East. I applied for the job on the Newcastle Surgical Rotation because I applied for core surgical training. I decided to do this quite late in my F2 year and wasn't very sure as to whether I wanted to do a career in surgery. As the year went on, I found that I had more of an inclination towards surgery and wanted to expand my experience within different surgical fields and find a career path that best suited me. The surgical rotation seemed to offer that in terms of a broad base of surgical training with quite a lot of emphasis on education for both myself and for teaching people as well, which is another thing I was quite interested in. So far my experience of the rotation has been very good. Everybody who's teaching on the organised courses for the rotation have been very enthusiastic, very encouraging, offered a lot of advice not just within surgery but for career progression as well. And outside of the formally organised teaching, the consultants that I have at the moment, the registrars, all are very enthusiastic in teaching me, getting me into theatre. There's been a lot of theatre time, especially in orthopaedics, which is where I'm in now. And there's also been lots of opportunity for me to teach as well, taking responsibility for the teaching for the foundation year doctors and also teaching medical students as well, which is something I've really enjoyed. My plans for the next job are to reapply for core surgical training. I'll be doing this time round with a far better portfolio, which is in no small part down to the teaching that I've received on the Newcastle Surgical Rotations, along with the advice that I've received as well from my educational supervisor. I hope to apply to both the West Midlands and to the North East. This wasn't originally my intention. My intention was always to go back to the West Midlands for my training. However, having experienced the training in the North East and coming to Newcastle and experiencing the city, it's a very nice place to live, and we've received very nice training as well. And this is something that I want to continue, so I'll be placing the North East jobs far higher in my ranking than I would have originally. And we're very happy to come back here for core surgical training, as the experiences of the core surgical trainees I've spoken to in the North East seems to be very similar to that of the Newcastle Surgical Rotations, and it seems to be something that would be really good for my further career progression in trying to become a surgeon in a speciality.